In this video, we're talking about how to fix your forward neck posture. First, we will go through some of the relevant anatomy and causes, then some of the common symptoms, and lastly, treatment for forward neck posture. A lot of the content in this video is from the article by Morrison 2018. It is linked in the description below. Anatomy and causes. The main cause for forward head posture is habit. For most of us, looking at our screens like that becomes normal. When we stay in this rounded position for hours and hours every day, our muscles at the back lengthen and resultantly become weaker, while the muscles at our front shorten and tighten up. When we are in this bad posture for hours and hours every day, common muscles that elongate and weaken include the deep cervical flexors, known as the longus capitis and the longus colli. These muscles are located along the front of the cervical spine. They flex and laterally flex our necks and provide stabilization for the neck. The erector spinae muscles are extensor muscles that attach to the back of the lower cervical spine and upper thoracic spine. The erector spinae helps rotate and straighten the spine. When the erector spinae muscles are lengthened, they weaken and lose strength to keep the neck and upper back from hunching. Lastly, the scapula or shoulder blade retractors. These are the middle trapezius or rhomboid muscles in the upper back. They help us keep a good posture by bringing the scapula or shoulder blades backward and keeping the chest open. Weakened trapezius and rhomboid muscles allow the shoulder blades to tilt forward, further contributing to the hunched shoulders. When our upper backs hunch, because we want to be looking at things in front of us, our necks bring our head up and we are left with a forward neck posture. Muscles that become short and tightened due to the long-term forward head posture include the sub-occipital muscles. These are four pairs of small muscles that connect the lower back of the skull to the top of the cervical spine. They help with head rotation and extension. When your head is tilted forward, these muscles work harder and continually contract to keep the head tilted up and looking forward. The pectoralis muscles include the pec minor and pec major. As the muscles in the upper back tend to become elongated as the shoulder rounds forward, the chest muscles may become shortened and tight. And lastly, the levator scap muscles. These originate from the posterior tubercle of the transverse process of the cervical vertebrae 1 to 4 and insert into the medial border of the scapula. The levator scap muscles strongly contribute to the elevating of the scapula, in addition to helping with various neck movements. If the shoulder blade starts to tilt forward and rotate up with rounded shoulders, the levator scapular muscles become shortened and tight. Symptoms, or rather, effects that you may experience are muscle soreness or an achy pain at the side or back of your neck. Pain might also spread into the upper back, shoulder, and head. Intense pain or burning sensation if the muscle goes into spasm or if you strain your muscle. Stretching your tightened muscles. Starting with the sub-occipital muscles. These muscles extend your neck, so we are going to do the opposite. Start by fisting your neck back into retraction. Then with the other hand, gently pull your head forward. You can look left, do the same, look right, and do the same. You should feel the stretch at the base of your skull. Do these gently. Hold for about 10 seconds each. To stretch the pectoralis muscles, find a door frame. If you don't have a door frame, find the nearest room. They usually have that there. Step forward with one foot and start stretching the pec major. You should feel the stretch across your chest. And then raise your arms to stretch your pec minor. And lastly, stretching the levator scap. You can do this in sitting. To stretch your left side, reach your left hand behind your back to grab hold of the chair, as I'm doing here. And with the right hand, gently pull your head downward and to the right, while you look towards your right pocket if you're wearing pants with pockets. Next, we strengthen the lengthened muscles. Two very effective exercises. With the lightest resistance band you can find, set up as I have, with the resistance band at the base of your skull, and do retractions in this position. Repeat for about 5 to 10 repetitions depending on your strength, and then do these 2 to 3 times a day. And if you don't have a resistance band, find something like this ball or this bolster, something that you can compress, and do the same retractions but on the floor. The second exercise is one for your rhomboids and your lower mid traps. As we talked about earlier, with a hunched back, our necks are forced to bring our heads up to look at things in front of us. So if we can strengthen and straighten our upper backs, we are 3/4 of the way there. So start by lying down on your tummy. You can do this on the floor, on a bench at the gym, or even on your bed. Start with a lighter weight or even no weight at all. Bring your arms up as I am doing, then extend your arms forward to engage your mid and lower traps. A lot of you will struggle with this. That's why you can start with light to no weight at all. Focus on the form. It's really quality over quantity here. And lastly, it's just consciously correcting your posture every day. Practice neck retractions everywhere you go. When you are doing work, driving, or watching TV. That's the end of the video. If you really enjoyed this video, like, subscribe, and turn notifications. And humans have 7 neck vertebrae, while ducks have 16, and geese have 17 to 23, and swans have 24. Don't worry about it.